So welcome everyone today to the webinar about organizational excellence through innovation. My name is Trish Livingston. I'm currently the Director of Operations with Workers' Compensation Board. I have a 25-year career in the government of Saskatchewan here in our province. Been working here most of my life, went to university here as well. I have a lot of experience and training in improvement work and innovation work throughout my career. Basically, the last 15 years been really focused on supporting innovation in the healthcare system and education system across our government, now with workers' compensation, supporting some of their transformation efforts. I've been certified in a number of different methodologies in this area, in this field, and also come with a master's degree in organizational development and applied research and evaluation, which has served me really well in this field as well. So I'm really excited today to present this webinar to you to talk a bit more about the Organizational Excellence through Innovation Certificate program that we have at the University of Regina. So today our objectives are to learn about the modules that are going to be offered through the Innovation Certificate program. I will be giving you some tools, more than one tool actually, but we'll talk about the tools within the framework of the model for improvement, which is really a simple and powerful tool for accelerating improvement in your organization. So we'll get some tools and templates today even and get a taste of what the Innovation Certificate program will look like. So the model for improvement is based on applied science of improvement and really emphasizes innovation, rapid testing, and replication. And it draws on many other disciplines like psychology and statistics for methods and tools. So you'll probably notice that the model for improvement is somewhat like the research method, where you have a hypothesis and test it and then come to conclusions and recommendations about what the next step should be for implementation. So we'll talk a little bit about how a lot of these methods are based on science. So just to introduce you to the Innovation Certificate program, I wanted to let you know there are 7 modules. There are 4 required ones. So the fundamentals of innovation needs to be taken first. Then there's identifying innovations, problem solving, and implementing change. And then you get to choose from 3 electives. So I think we have a really nice, well-rounded collection of electives to choose from. We have change management, how to inspire innovation, data analytics for innovation, leading through uncertainty, and how to facilitate staff and client engagement. So you get to choose from 3 of those. I know at the end of the presentation, I'll provide the schedule, but I know there is Fundamentals of Innovation coming up in June and one in September, which is the first course that needs to be taken first in order to proceed with the rest. And then I'll show you the schedule as well for the remaining modules. The Innovation Certificate program is unique in that we are offering it this year in a hybrid format. So there will be some online work, some pre-work to be done as well over the course of each module. And within each module, we look at case studies to help us understand the concepts. There are interactive simulations that are done. There is a great deal of tools and templates provided. I'm personally a fan of always walking away from some training with some tool and templates. So there's a lot of templates and tools you'll get that you can use right away in your organization. We also have provided a list of additional readings that you can access for more information or to go a bit more in depth. We also do have experienced facilitators and coaches. So currently there are 4 of us that are providing training in this program, all of us with unique experiences, which again provides students with a really well-rounded foundation in this field. And then we have optional assignments. So between each of the courses, there are assignments that you can take and apply in your work settings or in your personal life as well to test out some of the models. Okay, so first we're going to talk about the model for improvement, and I give you a bit of a hint of what the courses might be like. And I think this can really help innovate during crisis, which I know we're still in a global pandemic or anytime. So I just want to spend a little bit of time reflecting on the pandemic because it has given us kind of an interesting perspective on innovation. Behaviorally, we'll talk a bit about how to engage employees and clients in identifying and testing ideas. And then in terms of practical objectives, we won't be practicing today, but I will show you some of those tools and how you may use them in your own organization. So just wanted to take a minute for each of us to reflect on what some of the innovations have been that have been implemented in your organization, or perhaps that you've noticed out in the community since the pandemic. So just wanted us to each take a moment to just kind of think about some of those things. We were forced really into innovation through the pandemic. A lot of things needed to happen rapidly, and often change is quite slow. But what we've seen through the pandemic is it was an impetus for us to make some rapid changes. So some examples would be court trials now and physician appointments being provided through video conferencing. I know even in my own organization, we are having counseling and psychiatry services being offered online from psychiatrists outside of the province, which has really helped us to deal with the backlog in our current system. We transitioned very quickly to online learning for K to 12, and certainly I think there's lots of pieces of that we won't completely go back to the way things were. I know I have one child still in the K to 12 system, and I think it's fantastic that you can go on and look at the assignments, the coursework, the materials online from the computer when you're home, right? So if you've missed an assignment, you can go on, and missed a day of school, you can go on and fill it in and complete it online, and so you're not really losing the day like you used to. We had contact tracing apps that were created and across the country, and we had regulations that changed really quickly as well in response to customer needs, particularly the one around tenant evictions. And we had companies that pivoted to make different products. So distilleries pivoted to make hand sanitizer, and I know a wedding favor company transitioned to make masks. This is where I got some of my favorite masks from. But because weddings weren't happening in person and they just didn't have that much business, they transitioned to making masks. So when we're looking at a crisis response, we want to start to look at some of those things that we started that were in response to immediate demands, but that are working well. And so we want to amplify those and put those things into practice because they've shown some promise for the future. So like the K to 12 education online, obviously some pieces of that are going to continue. I think even at the university, hybrid options are going to continue because there was a lot of success and promise seen within those practices. There are some other things that we've had to let go of, that we had to stop because of the pandemic, and now we want to restart them and can pick them up in some form. So again, it gives us a really interesting perspective to think about what more can we do to innovate? What do we need to do to operationalize some of those things that were, again, put in a crisis state? And what things do we need to reinstitute, restart, and what might we learn to incorporate into them? So to create innovation, we really need to experiment and adapt. And that's really what the model for improvement is all about. It's about taking some risks and doing some small experiments, some small bets to see what we might be able to trial, and then adapting it for implementation as we learn. The model for improvement has three main steps. The first one is, what are we trying to accomplish? How will we know that a change is an improvement? And what change can we make as a result of that improvement? So it really follows this plan, do, study, act cycle, which we'll get into a little bit further in the webinar. And as I mentioned, this is based on the research method, where you set a hypothesis, plan out what your test or experiment will be, study the results, and then act on it, whether you implement it or try another experiment. So in the first step of the model, what problem are we trying to solve? Often we jump to conclusions about what a solution would be, right? We think we need a new IT system. We think we need more staff. But if we spend more time doing some analysis and some root cause analysis of what is the problem statement, understanding very clearly what is the problem, and then understanding very clearly what are the root causes of that problem. So doing some analysis, collecting some data, some information, and doing some some analysis of what are the most important root causes of that problem as well is really key to solving the problem quickly and permanently. So like this quote from Albert Einstein, who says, you know, if I had a problem to solve, an hour to solve a problem, I'd spend 55 minutes thinking about the problem and then 5 minutes thinking about the solution. So in the same way, we don't want to get stuck in analysis paralysis, but really important to clearly understand what is the problem we're trying to solve and what are those root causes. Because often we end up with a solution that doesn't address our problem. We end up spending a lot of time and money and investment in a solution to only discover, you know, down the road that it hasn't actually solved the problem that we had hoped it would. So one example I can give you is I was working with the Board of Education in one community, and they were sharing their strategic plan with us, and we were coming in to help them with identifying some improvement opportunities. And they said, well, we have this plan to implement this new IT solution. And so we asked, okay, well, what problem is it solving? So they spent about an hour going back and forth because this was a major initiative for them, a huge investment, discussing the problem. And after that hour, again, with just that one simple question, they came to the conclusion that the IT solution wouldn't actually solve the problem that they were hoping it would solve and that they thought it would solve, and that it actually needed a different solution. And so sometimes that can be a really powerful question to just really think about what problem are we trying to solve. The next step is, how do we know a change is an improvement? And so all change is change, but not all change is good. So we do need to monitor to make sure that we're having the intended impact and that we aren't having any unintended consequences. So this is one of my favorite quotes, that in God we trust and all others must bring data. And even as you're assessing the problem statement, again, you know, how do we know it's a problem? What does the data tell us? And what more specific information can we find out about that problem by digging into the data? Is it all customers that feel this way, or is it a segment of the customers that feel this way? So data is really important for helping us understand the problem, but also in helping us know whether the change is effective. And that's why we do have a course, one of the electives, entirely on data. And then the third step is, what changes can we try? And so we want to focus these changes on things that are quite small in scope. We call these things small bets. They don't take a lot of investment, but these small, seemingly insignificant improvements really add up over time and help us to achieve our end game. So again, we sometimes imagine innovation as this big, this big complex thing, when in fact, if we focus on some of the smaller changes, and again, using the data to drive where we need to make the innovation, we are more likely to have success. So I do have a video here. You will have to let me know if the sound is working. So if someone could just give me a thumbs up in the chat here once I start the video.
Every time you start out on a journey.
Okay, can someone let me know if they heard that? Okay, good.
Whether it be by land or sea, you need to have some way to guide your journey, some roadmap, a compass, if you will, that gives you direction and gives you some sort of sense of where you're going. Well, we have that at the IHI. It's called the Model for Improvement. The Model for Improvement gives us the foundation and the framework for doing improvement work. It is really structured around several key components. Basically, two major sections of the Model for Improvement. First of all, what is your aim? How will you know that a change is an improvement is the second question, which gets to measurement. The third question deals with what changes can you actually put in place to achieve the aim. So these three things continually loop together. We always check ourselves against our aim. How good, by when, is typically one of the things we ask in the name statement. How good do you want to be? And then by when? It's not good enough just to say that we want to be in the top decile, top quartile, but by when? Let's give a date. The measures. Are you going to look at process and outcome measures? And then what changes are you actually going to put into place that you can track with data and then match back up against your aim? This then gets carried out in daily work with a team through something called the PDSA cycle, or plan, do, study, and act. The three questions give us the framework that we always go back to. What are we trying to accomplish? How will we know changes and improvement? What changes can we actually make? PDSA cycles is where we do our testing on a day-to-day basis. We go out and we take the ideas, we put them into a PDSA cycle, we plan it, we do it, we study it. That is, we get the data, we come back up and look at this question, and then we act. That is, we're going to change our plan based on the feedback we obtain, and then we're going to go through another cycle. This then becomes our model and our framework for how we're going to actually carry out improvement strategies. It gives us our guide and our roadmap. Let's think about improving patient satisfaction. To take people from being neutral, or oftentimes not real happy with the services or the care they get, and to make them more happy customers. How do we do that? We might have a survey that we use on a regular basis. And right now we see that we're only getting about 45% of the patients in our outpatient clinic saying that they are very satisfied with the care they received. Well, we might say, if we're developing our aim statement, how good do we want to be? We want to be at higher than 75%. How good and by when? We're going to do that over the next 6 months. So anytime we write an aim statement, we want to know how good and by when. That is, we're at 45%, very satisfied. Within 6 months, we want to elevate that up to 75%, very satisfied. Now, the measures. We want to look at outcome measures. The outcome measures might be the percent marking very satisfied. That might just be a simple one measure on outcome. But we also then need to have process measures. Maybe it's the wait time in the clinic. Maybe it's the availability of an appointment. These would be two very useful process measures, because those processes will in fact influence the outcome, that satisfaction. Then what changes are we going to have? Well, the changes might be that we're going to have early pre-registration. That might be an idea. We might allow people to send in information via the internet or fax in their request. And we might have a tickler system where we call them back to remind them of their appointment. So now we've combined the three questions, our aim, our measures, and our change concepts. We're then going to go out and do that. Starting next Monday, we're going to empower the team to start doing these changes and see if the satisfaction survey results actually start tracking. And then what we're going to do is we're going to track Monday, Tuesday, Wednesday, etc. And we're going to track the percent saying very satisfied, and we'll be able to start making a chart. We'll mark where we instituted one of the changes, and then we'll see if in fact it had the desired effect, moving it upwards. So by combining the three questions with the PDSA cycle, we're setting ourselves on a very good path to give us guidance, direction with a model for improvement.
Okay, so that was a healthcare example from the Institute for Healthcare Improvement. They do have a lot of videos on improvement and innovation that you can watch for free, lots of templates as well that you can download. And I know it's a healthcare example, but the model can apply anywhere. And I have confidence saying that because I have seen it applied in different settings, office settings, healthcare settings, education settings, manufacturing settings. It really does work anywhere you have people doing processes and you have some problems that you need to solve. So that's basically any organization. So this did give you an example from healthcare. It does show nicely how measurement can be linked in, how those small tests of change can be undertaken, and how we track that to see whether or not they're they're making a difference or not. I know, for example, in healthcare, another one I often think of is a unit that was looking to reduce falls. Overall, in the province, we were trying to reduce falls in the healthcare system, because obviously falls, when patients fall within a system, within the healthcare system in hospitals or nursing homes, they often acquire additional injuries, right, that they didn't come into the hospital with. So we do want to keep our patients as safe as possible in the hospitals. And so one unit was trialing different ways to notify staff and other people in the unit that they had someone who was at particularly high risk for falls. So they tried different things like different colored socks. They tried putting leaves on the door as a symbol of, this person's at risk for fall, because leaves symbolize fall. So different things that they could try and measure to see if they could have a reduction of falls in their area. So lots of really creative ideas for, again, small tests of change that would impact overall not only their fall rate and the injury rate and mortality rate that our patients might have in that unit, but in the hospital overall and in the province overall. So again, a way for each area to contribute to that larger goal by making small tests of change. So why do we want to test small things? They are less costly, they take less time, there's less risk involved, and it really does give us that opportunity for learning. It's a very powerful tool for learning. And failed changes are also a learning opportunity. So I've heard people say failing is just the first attempt in learning. So if you think of the words or the letters within the word fail, first attempt in learning. So even failed experiments are very valuable and should be valued in an organization that's focused on innovation as well, because what that means is we've taken a small bit of risk, we've learned from it, we've learned what not to do, what we need to change to come up with a better idea. It's also safer and less disruptive for our clients and staff if we can take small tests of change. And because people are involved in the testing and developing ideas, there's often less resistance too. I know in big manufacturing companies, often if you make a big change, and well, this isn't just for manufacturing, but I've heard some examples of where manufacturing companies have made big changes, right? Big investments in new systems for automating something, or new systems for transporting items around their factory, and have had to spend a lot of money on rework and revisions to those projects, right, that are very, very costly. So by doing a small test of change first, we can really identify whether that big change is going to be work for us, and whether that big investment is worth it before we launch into it. And also, it's rarely that one big idea will solve the problem. Usually it's a combination of multiple ideas working together. And in the training, we do have some tools as well for if you have a more complex issue and need to look at all the different ways we can solve it. So for example, in the healthcare system as well, right, when we're looking at reducing surgical wait times, there's a number of different components to that. Things that will address that, right? How people are referred in to surgeons, how the operating room manages its patients. There's even prevention things, right? I know when we were working on the surgical initiative in the healthcare system, one idea was around how we reinstitute the dental care program in northern Saskatchewan to prevent children needing to come to the city to have dental surgery. So we're preventing surgeries, we're making surgeries happen smoothly, we're making sure that referral process from your GP to the surgeon is happening quickly. So there's a number of different changes that need to occur in order to solve that problem. And so we do have some tools as well that will show you how to figure out what are the main drivers affecting that problem. So the PDCA cycle, sometimes called the PDSA cycle, we've kind of already been introduced to in the presentation, but it's plan, do, check, act, or sometimes plan, do, study, act. So in either model, in the third step, what you're doing is checking or studying to see whether or not the change you've made has had an improvement. And so this is a really great way to help us learn what the changes, or how the changes will impact our system before we implement them. So planning is just figuring out the details of who will make this change, when, and what will the change be, and how are we going to measure it. So again, making sure we're really clear on, focusing that change on that piece of information that we have now discovered from the problem statement that we know needs to be solved. Then the doing is carrying out the plan, putting that into action, checking to see what worked, what didn't, and then acting upon what we have learned. Already mentioned this, based on the scientific method, so much like developing and designing an experiment and measuring the results, and then taking appropriate action based on the results. And plan, do, study, act cycles should be iterative. So once we do a test of change and we've decided to adopt it, then we need to put a standard in place so that we can sustain that change and then we don't slip back to old ways. So I do kind of like this graph or this visual with the kind of those stoppers in place. So the standard makes sure we don't slip back, and then we can continue to make more improvements and move further ahead. And so what you'll see over time is just greater improvement over time because we have standardized and locked in those changes. And learning about how to put standards in place is also one of the courses. So in the planning stage of your PDCA model, you really want to focus on bringing together a team that has knowledge of the problem and all the various components of it. So it really is a collaborative, team-based approach. So we like to say problem solving is a team sport. You want to also consider whether you could include clients, either internal or external, as part of the team. We do have that whole module around engaging clients, but it will be a component of each module because we strongly believe in bringing in clients to help you with improvement and innovation work. They understand your problems because they're living them and experiencing them on a daily basis. And they also have great ideas for improvement, and they're a source of feedback for your ideas on improvement as well. So you want to achieve some consensus on the clear problem statement, try to get it down to even one sentence that you can all agree on, and talk about why the problem is important. What impact is it having on, say, quality or safety or cost or engagement? And what impact is it having on your employees and clients? And then identify that quantifiable gap between what is our current state and what is our future. So for example, I know we were looking at one point in the education system at how many more educational assistants would we need, and some of the problems around recruiting and retaining educational assistants. And so being able to look at what is the gap between what we need in the system, and we've got new centers opening up that are going to need educational assistants. So what is our actual need, quantifying that? What is our current state? So being able to show the gap between what we have and what we need. And then also, because of the recruitment and retention issues, just how often are those positions turning over? What's the turnover rate like? What is the education qualifications like, right? In many situations, if you can't find a qualified person, you're having to underfill. So getting all of that data together so that you can really understand the problem clearly. And then gathering and analyzing some data on the current situation. You can use, again, pictures, charts, graphs, data. A value stream mapping is, again, process mapping, value stream mapping are things that we cover in the course. And set a really clear, specific target for improvement, using root cause analysis tools to identify the sources of the problem. And again, prioritizing those as a group, again, which are the ones that we can leverage for the greatest improvement. So you want to evaluate those proposed actions, again, come to consensus on which ones will have the biggest impact. And then the do stage, developing an action plan of who will actually try it out with what change and when and for whom. Implementing the plan, collecting data as you go, because you want to be able to evaluate how it went. And as well, keeping track of any unexpected effects or general observations. And then finally, in the study stage, what you're doing is looking to see, did the plan result in an improvement, and by how much or how little? And were there any unintended side effects? And there's, again, different tools you can use to evaluate the improvement. You saw even in the video, the little sort of hand drawing the run chart to say, here's where we were before, here's the line in the sand where the change was implemented, and then what impact did we have on that? And then finally, the act stage. And I've always found this one a little bit, yeah, I always feel like there should be a better word than act, because really there's three different options here for us. We can adopt the change if the team has determined that the pilot, the test of change was successful. Then how do we standardize it to make sure it's sustained? Secondly, if the plan just needed some tweaking, then we can adapt and we can maybe come up with another experiment. Maybe we just need to adjust a little bit and say, well, that didn't work perfectly, but maybe if we tried something slightly different, we would have a different success rate. And then finally, the third one is abandon, but this doesn't mean walk away and wipe your hands and say, I give up. This is where we want to fail forward fast, right? And use that first attempt in learning. So we want to come up with an entirely new and different plan. So if that didn't work, what did we learn from it that we can use to inform a new idea? And then, of course, afterwards, celebrating. Again, we talk about this a lot in the course, is just how to engage your employees and other collaborators in your improvement work, and some of the lessons learned around, really needing to communicate accomplishments, taking time to preserve the gains, and making long-term plans for additional improvements. So some of the tools then in this particular module that you would learn more about, we have a problem statement template. We have some root cause analysis tools. We have some key change drivers, driver diagrams that you can use for that purpose. We do, again, have some tips and guidelines, readings, and things around how to engage clients, and the Plan, Do, Study, Act template. So we'll show you a few of those. Before we wrap up today, we won't be going into a lot of detail how to use them, but I'll give you a hint as to what they look like, so you can have a bit more understanding of what some of the tools might look like. So in terms of problem statements, we are asking people to look for a deeper understanding of the problem. What do they still need to learn, and how will they learn it? So how will they go out and get that information? So if we don't know if it's affecting all customers or just a segment of our customers, how do we get that information? Or if we don't know if customers are satisfied or dissatisfied with the new process, how do we gather that information? And a problem can be something that is causing you concern in one of these 5 areas. We use this as a lens to just look at our problem and determine, is it something that is a quality issue? Is it a cost issue? Is there a delivery issue? Is there a safety issue for our clients or for our employees? Or is it an engagement issue with our own staff? So again, can really help identify why it's a problem and why it's important to solve. In your problem statement, what you want to do is come up with a really clear, simple description of the problem. So as we talked about earlier, that if you can even get it to 1 sentence, it shouldn't have any solutions or assumptions about cause in it. It should just be strictly, here's the facts around this particular problem. Here's how it's impacting our organization, our employees, our clients, and some specific information on, what is the size of that gap? Is it affecting everyone everywhere? Is it just certain sites? That type of information. And we also want to consider what the impact is, again, for our employees, the organization, and our clients. So for example, if we do have untrained or undertrained staff at some sites, what that means is our employees and clients could be at risk of injury. Our clients aren't receiving the quality service or product that they expect. And our employer could be put at a greater risk of litigation due to errors or injury, and also face high retraining costs due to the turnover rates. So again, really being specific around what some of those issues are, and if possible as well, getting those measures to indicate that impact. So within the course, we do have a number of templates. This is a simple sample one for a problem statement. We do go through this in the course. We have students work on a problem statement from their own lives or from their own organization, and then we do some sharing as well, and help each other to articulate really clear problem statements. We also talk about root cause analysis in the training. So this is looking for those direct causes and then indirect causes and then the root causes. So often we stop at the direct cause and don't do a lot of digging. And so we do have some tools that will help you move kind of beyond what the symptoms are and move into understanding better what the root causes are. So you would be learning about things like the fishbone diagram, the 5 whys, value stream mapping, the driver diagram, as we talked about for more complex problems, and Pareto diagrams, which sound really fancy, but are really just charts that tell us what 80% of the issue is with a particular problem. So in this example here, we're looking at reasons for service calls to an IT desk. And what this chart is telling us is that 80% of our problems are related to our clients forgetting their passwords and forgetting their usernames. So that would tell us if we could just institute something like maybe say a self-serve for clients to change their passwords and usernames on their own without having to call the service desk, that we would have the greatest impact on reducing service calls. And so when we're looking for root causes too, we often, as I mentioned, don't think far beyond the symptoms. So I'll maybe just jump here to the third column in the interest of time. If we see a task being carried out wrong in our organization and we see the reason initially as the staff aren't following the procedure, that can lead us down a path to finger pointing or blame. And in this course, we learn a lot about how we really want to be hard on processes and easy on people. So the people we've hired to come in and do this process, most of the time, 90% of the time, are there trying to do the best job that they can and trying to follow the procedures that we've set for them. And so often we can get easily fall into the trap of blaming staff. Oh, the staff aren't following the procedure. I don't know why they're not, and not digging deeper into the issue. So particularly with that one, what you can often find if you dig a little deeper is that maybe we didn't provide enough training to the employees to be able to take on that procedure. Did we explain why that particular procedure is important? Have we given them proper orientation? It could be that there's no enforcement policy either. Maybe we haven't taken the time to establish how we'll measure compliance with that procedure if it's something very important. Or maybe it's a poorly written procedure that's very difficult to understand. And again, not the fault of the staff, but we need to look at improving that process, improving that standard around that process. So when we're looking for root causes, what we're doing is we're starting with that gap in our problem statement between what's the target and actual, and then moving towards what are some of the causes that are preventing us from meeting the target, and then doing some sort of prioritization of them. What are the causes in order of importance, or what has our group come to consensus on? What are the most important causes? And then which actions will we take that address the most important causes? And again, that's a really simple but powerful way of making sure that we quickly and permanently solve problems. Throughout the courses, through all the modules, we talk about client and employee engagement. As I mentioned earlier, it's really important to tap into their knowledge to help us better understand the problem, to identify ideas and get feedback on implementation. Again, that engaging both clients and staff can be tricky for some leaders in organizations. And so we do provide some tips and tools as to how we've seen that done effectively and some ways to kind of get over the barriers and resistance to wanting to engage them. We have some really cool tools as well for getting input from our clients and getting kind of that we call the voice of the customer. So you will learn about things like empathy maps, which again, really puts us in the shoes of the client and thinks about what things do they hear, say, see, do when they're engaged with us in providing service. We also will learn about things like journey maps that again, look at the different process steps and help us identify what is the client feeling along each one of those steps. And again, helping us to identify where we might tackle some improvements. So I won't get into this example too much, but if you look at the line chart there in the middle of the slide, you'll see the happy faces and red sad faces. And so those red points are certainly where we would want to focus efforts based again on the voice of our clients. And for engaging staff, again, we talk about this through every module, but how to make sure our leaders are following through on staff's ideas and have dedicated time to participate in improvement and innovation work, and also how we create a safe environment through all of our efforts, create that no blame, no shame culture, focusing on transparency, improvement over performance reviews, and encouraging testing and failing to get to the best solution. And we also set ground rules for, how everyone in the organization has an equal voice in innovation and improvement. It isn't about a select, highly specialized group of people who do this work. We really want to involve anyone who has something to do with that problem. And so sometimes it requires setting those ground rules to make sure everyone has an equal voice. We do have the PDCA template as well that we go through in the course, and something you can take away with you to help you plan out your small tests of change. And we do provide a lot of tips on how to assess your PDCA to make sure that it's proper scope and size. And tips about moving into action as well, thinking about how do we plan change so that we can be effective and effectively solve the problem. We have an entire module around measurement, and again, one of my favorite quotes: "You can't fatten a cow by weighing it." I think lots of times in organizations, and I've seen this in lots of organizations I've worked into, we measure something, we measure maybe client satisfaction or wait times, and we've measured it every year, year after year, and it's just the same, right? Nothing has changed. So we need to shake up our processes. We need to actually make improvements and actually implement innovation in order to have an impact on that. Otherwise, we can't just expect improvement to happen because we're measuring. Now, we do need to measure to see what impact that change has, but measurement alone will not change anything, right? We need the measurement in order to drive some action. So we really talk about that a lot, about how to use the measurement to figure out where to make changes, and only measure what's important and measure what will drive action, as opposed to measuring everything we possibly can. Because nowadays, especially with technology, we can measure a lot of different things, but we want to be really focused in our measurement efforts as well. And we have, again, a whole module on leading for innovation. We have someone leading this course who has had a lot of experience as a CEO in different organizations leading innovation. And some of the principles there we talk about are respecting every individual, which is foundational to, again, an organization that's really committed to innovation, leading with humility, embracing that scientific thinking, focusing on processes, thinking systematically, and creating value for our customers. So again, these are all concepts we go more into depth in. So I think in conclusion, what I wanted to say is that, to really succeed with any kind of successful improvement or innovation initiative, it does take some time to learn the methods, some time to use them, but the results are worth the investment because, as I mentioned, you can more quickly and permanently solve issues by having a structured and systematic approach. So just a reminder again, these are the 7 modules. The 4 at the top are the required courses. Then you get to choose from the electives at the bottom. There are 5 of them, if I'm counting correctly. I do have a little blurb here about the course schedule. It's also available online at the University of Regina's Continuing Center for Education website. There is a session coming up on fundamentals of innovation in June and one in September, which, as I said, must be taken first. And then there are the other required courses that are happening this fall. So you can see some of that. I've also pasted in here some of the hours around the courses. So the courses are 14 hours each and currently delivered in a hybrid model, and the course fees are there as well. And with that, I'll turn it over to our host, who I think has been gathering questions, or if you have questions, please feel free to add them into the chat now.